The day of the surgery, we got there, all the nurses were amazing there. So they screwed on this frame on my head to keep it still. So after the frame we put it on, we went back and obviously I went to sleep. And while I was asleep, they drilled a portion of my skull. They cut out that, and where the skull is missing now is actually the battery device and where it stores the data and everything. And then I have 2 anchors on the back of my head that have leads to my temporal lobe so that the surgery can shock when it needs to do. Because the device, the RNS, it's responsive neurostimulator. It's similar in some ways to like a pacemaker or a defibrillator, but it's for your brain and seizures. The doctors, they were amazing. They gave me a few different medicines. We got it right. And then it was about 6 a.m. the next day that I was able to eat again. I was basically back to normal other than the pain. For brain surgery, I was really shocked at the lack of pain. Really, the worst pain was the anchors in the back because they stuck out more. So it was like more pressure on the skin and stuff. Not really what I expected out of brain surgery. One funny thing was when Dr. Singleton came to check on me, he said, "How are you doing?" I said, "My head hurts." And he said, "Well, we'll get the guy that did that and we'll take care of him later." And so that was really funny. Dr. Singleton, the nurses were all very kind. I kind of felt like a celebrity there. I was supposedly the second person to get the RNS surgery there. And the first patient was actually the day before me. So I was the second celebrity.